Okay, I think we'll go ahead and get started. We're really excited for everyone who's joined us today. Thank you so much for making time to be with us for this webinar on advancing menstrual health education and economic progress, a comparative study that we're going to be looking at today and launching. It's going to be an amazing resource for the menstrual health field. We want to welcome our colleagues, friends, and partners. We're glad you're able to join us this afternoon or morning, depending on where you're located. We're excited to spend the next hour with you as we discuss this new study. As I mentioned, advancing menstrual health education and economic progress. It's a comparative study. My name is Diana Nelson, and I'll be the moderator for our panel discussion today. I'm the Global Advocacy Director for Days for Girls International, a nonprofit organization working to advance menstrual health, recognizing that local leaders are best positioned to drive that long-lasting change. We train and support social entrepreneurs, volunteers, and partners to address the multiple facets of menstrual health, from manufacturing washable pads, providing menstrual health education, and advocating to improve menstrual health policies and programming. On behalf of Days for Girls International, the law firm DLA Piper and their nonprofit affiliate, New Perimeter, the African Coalition for Menstrual Health, UNFPA East and Southern Africa Regional Office, and in partnership with the Toilet Board Coalition and the Global Menstrual Collective, we want to give a very warm welcome to each of you and a special thank you upfront to our esteemed panelists. Before we move on, I want to discuss how we'll be interacting today. If you're in the audience, you'll be muted during the webinar, but if you have a question, please type it in the question and answer box, and our panelists will do their best to answer them at the end of the panel discussion. Please also introduce yourselves in the chat box, sharing your name, your organization, the country where you're working, so we can get to know who's with us today. So with that, I'll just start us off. On October 11th, we celebrated International Day of the Girl, and the theme selected for 2022 was Our Time is Now, Our Rights, Our Future. Along with this theme, one of the calls to action was to provide resources for girls to support their education and prioritize their mental and physical well-being. This year's theme and this call to action is a perfect lead-in to this webinar because it recognizes that education is vital to the economic progress of girls and that girls are needed to play pivotal roles to help shape a more equal future. And part of their rights is access to timely, age-appropriate menstrual health education. In order for women and girls and people who menstruate to have an equal future and overcome the challenge of period poverty, we have to acknowledge that menstrual health is a matter of human rights. And this right is infringed when women and girls and people who menstruate cannot manage their menstruation with dignity. To combat this challenge during the past decade, we've seen governments choosing to challenge menstrual stigma and barriers that have existed in our communities, and they're taking action at the national level to address menstrual health. This study, Advancing Menstrual Health Education and Economic Progress, a comparative study, it reviews the menstrual health landscapes, including national and local laws, policies, and programs that address menstrual health and reproductive curricula in 12 countries, both high-income and low to mid-income countries. For our webinar today, we've divided it into basically 3 parts. The first part is you'll hear from our esteemed partners from New Perimeter, who will introduce this report and share a high-level learnings from it. Then the second part, we'll hear practical lessons learned from menstrual health experts from India, the United States, Kenya, and Uganda. And then we'll conclude coming back to Noor, who put the study together, to share transferable recommendations to help each of us and other stakeholders be better advocates for menstrual reforms. So I'm going to turn the time over now to Sarah Andrews, who's the co-director of New Perimeter, the nonprofit affiliate to the law firm DLA Piper. She's going to share why did a law firm want to look at the menstrual health landscape in 12 countries, and she'll share how it was conducted. And then we'll go directly to Noor Kara, who's an attorney at the law firm DLA Piper, and she'll share high-level review of lessons learned, challenges and gaps and successes that came out as they studied the 12 countries. So Sarah, I'll turn it over to you.
New Perimeter is the nonprofit affiliate of the global law firm DLA Piper. And through New Perimeter, DLA Piper lawyers work on pro bono projects in underserved regions around the world, focusing particularly on women's advancement. We started working on this project in collaboration with Days for Girls in late 2021. And our talented legal fellow, Noor Kara, who you will hear from today, had worked in the menstrual health space previously, and she really was a very passionate advocate for us working on this issue. She led an effort to reach out to a number of menstrual health experts to determine if there was an area of research that we could pursue that would be helpful to advance scholarship and support advocacy in this area. And based on our consultations with a number of experts, we decided to undertake comparative international research into the laws and policies impacting menstrual health in the education sectors of a cross-section of countries. We selected 12 jurisdictions for their diversity in geography, governance, socioeconomic status, and cultural connotations, as well as for their availability of information and our availability to connect with experts on the ground through Days for Girls. We recruited a team of over 20 DLA Piper lawyers from a number of countries to undertake the research. And through Days for Girls, we connected with over 20 local experts whom the lawyers consulted and interviewed. The end result is this report, which highlights some of the harmful practices that widen the gender gap in diverse regions and presents examples of enacted and proposed supports for women and girls in formal school settings. It also includes comparative analysis to offer recommendations to stakeholders working on menstrual reforms. And I will hand it back to Diana or to Noor to continue.
Noor, you can go ahead. Thank you, Sarah.
Thank you, Sarah, and hello, everyone. Thank you for joining us today. As Sarah mentioned, my name is Noor Kara, and I am an attorney at the global law firm DLA Piper. I have had the pleasure of working with Sarah and Sarah's team at our nonprofit affiliate, New Perimeter, to develop a multi-country study on menstrual health. From my prior work experiences in the global health space, I have seen and been part of program implementation in the menstrual health space, but I envisioned a study that could demonstrate and advocate for government participation and civil and civic engagement. A study that outlines how public policies and laws can sustain programs. So this report primarily analyzes the laws, policies, and government-funded programs that enable menstrual supports for school-age children in the formal education sectors of 12 countries. The interventions featured in this report span a wide variety of menstrual supports, including period product distribution, menstrual health curricula, access to private toilets, clean water and disposal facilities, as well as behavior change and psychosocial supports. The report also touches on the vital role that NGOs play in the menstrual health space as they work hard to reach underserved communities, and how the COVID-19 pandemic, which is still ongoing, and the closure of schools and economic downturns have disrupted the localized delivery of information and safe supplies and medical care for menstruators. So briefly, I'll share a few quick examples of interventions that we have featured in this report. First, Chopadi in Nepal has been widely publicized. It is the practice of segregating menstruating women and girls to huts outside of the house. In 2005, the practice became illegal, but it was not actually until 2018 when criminal penalties were attached, and the practice still persists in certain parts of the country today. However, Nepal's Ministry of Education is now revising national school curricula so that textbooks and courses address menstruation and menstrual stigmas directly, including Chopadi, and this curricula will be taught to school children starting at grade 4. A second example is the National Sanitary Dignity Implementation Framework, which was developed by South Africa's Department of Women, Youth, and People with Disabilities in 2019. The South African Treasury disperses funds to its provinces to implement this framework, and the department maintains a database of reports to track progress and implementation. And a third example is one that I'm sure we've all heard of recently, which is Scotland's Period Products Free Provision Act. Legal duties were attached to the Act just this year, and the Act requires local councils and education providers to make period products available for free in a range of public places. So even just from these few examples, we can see how interventions across laws, policies, and government-funded programs work together with multi-sectoral stakeholders to achieve sustained progress. And today we will hear from a few experts who provided wonderful insights for this report.
Thank you, Noor and Sarah, and just a huge thank you to them. One of the things I really liked when they knew they wanted to do, they wanted to contribute some work to the field, is that they didn't just make an assumption. As Sarah said, they met with 20 different experts to see where might there be a gap and what can we do to help fill that gap. And that's why I'm so excited about this study that we can all access, because it's really going to help empower us in our advocacy work. And I think, as Noor just said, it really speaks to the fact that we all have a part to play in this, and we have to work in tandem with government so that we see those long-lasting sustainable changes. So now that was the first part of the webinar. For the second part, we're going to go to our esteemed panelists, and we're going to hear practical lessons learned from them, because they're all menstrual health experts. So what I've decided to do, instead of having me introduce them, I asked each of them to take 2 minutes to introduce themselves, to share their professional background and involvements toward advancing menstrual health. So if it's okay, we're going to start with Arundhati Muralidharan from India, and then Jennifer Weiss-Wolf will introduce herself from the United States. Then we'll have Bridget Kurgat from Kenya introduce herself, and then we'll finish with our youth activist, Florence Mwana from Uganda. So over to you, Arundhati.
Thank you, Diana, and a very warm welcome to everyone. A big thank you to DLE Piper and New Parameter for this fantastic report. I think it's something that we can certainly use for global advocacy. So I'm Arundhati Muralidharan. I'm joining you from New Delhi this evening. I represent, I've co-founded the Menstrual Health Alliance India, which is an ecosystem enabler for menstrual health and hygiene in India. And I'm also the coordinator for the Global Menstrual Alliance. I've had the great opportunity and privilege to be engaged with menstrual health and hygiene work for more than 15 years, spanning and getting an exposure to direct interventions, to research, as well as policy advocacy. And I hope to kind of bring in those varied experiences to really figure out how we can strengthen action in this space, both in country as well as for global advocacy. So I'm delighted to be here, and thank you for this opportunity. Back to you, Diana.
Okay, Jennifer, do you want to introduce yourself? And then Bridget right after you.
Sure. Good morning, everybody from New York City. It's 8 o'clock in the morning. I'm Jennifer Weiss-Wolf. I am an attorney. I am an author, and I'm an advocate. I currently work for NYU School of Law. I lead its Women's Leadership Network, and have spent the past 12 years or so at a think tank in New York City called the Brennan Center for Justice. All of that is sort of my day job. My side hustle, as they might say, is menstrual equity, access, health, education. I've been part of the US policy landscape, really thinking about what kinds of policies are actionable here in the United States. Often as compared to global counterparts, I think the US has perhaps been a little behind on this, but we've seen great progress and truly a grassroots movement emerge across the country. And for my part, I've been sort of framing and conceptualizing the policy directives and doing a lot of public writing about it. I use public writing as an advocacy tool and write op-eds. I wrote a book in 2017 called Periods Gone Public that explains a lot of the evolution of the policy framework. And lately, as sort of the politics in the US have been shifting, I've been focusing on the interconnection between menstruation and the state of abortion and reproductive health writ large in the US. And I'm also writing a new book on policies impacting menopause in the US. Thank you.
Hello, everyone. My name is Bridget Kruger from Nairobi, Kenya, and I'm the Global Advocacy Manager at Days for Girls. I'm a policy and programs professional, and I've been heavily involved for the last 8 years implementing menstrual health programs and also active in the advocacy side, and also heavily involved in standards creation of menstrual health products. And my commitment generally has been through community engagements, advocacy, and application of gender intelligence in community projects, and happy to be part of this webinar. Thank you.
Thanks, Bridget. Florence, do you want to introduce yourself?
Yes, okay. But I won't put on my video. Hi, everyone. My name is Florence Murana. I'm a feminist and a climate activist, as well as advocating for sexual reproductive health rights within rural areas of Uganda. I'm very humbled and privileged to be on this panel today. Thank you, Diana.
Thank you, everyone. As you can tell, we have amazing panelists. I'm going to jump right in, and we're just going to go around with questions to each of them. And so, Arundhati, I'm going to start with you. From your experience and the work that you've been doing, how do you see menstrual health education impacting the economic advancement of women, girls, and people who menstruate in India?
Thanks for the question, Diana. So I think that we all agree that menstrual health education is critical when we're looking especially at gender equity and movement towards that. But I also just want to break this down and to say that how in India have we been looking at it? India has actually been quite a front runner in having a menstrual health policy which dates back more than a decade ago, which had a focus actually on not just product distribution, but also on creating awareness among school-going girls on menstruation and menstrual hygiene. Now, very much in India, the focus has been on menstrual hygiene management, not so much on the other aspects of menstrual health. So menstrual hygiene management, schools have been a huge focus. And I think that this has been critical and important in various ways. While we don't have the evidence to really showcase how menstrual hygiene and health education has contributed to some of those critical school outcomes and economic indicators that we're discussing today. What we do see, however, is when we are providing girls with menstrual health education, when we ensure that the school physical environment is more conducive for them to attend when they are on their periods through the existence of water, sanitation, hygiene facilities for girls like a separate toilet, a complex for girls, that's something that has water, access to products in schools, access to dustbins and other disposal solutions like incinerators, as well as opportunities to chip away very slowly and perhaps fairly simply away at those social norms through campaigns that are done on various global days. We see that this does help girls attend school. It does help them manage their periods a little better when they're in schools. We also see from research that we've got from across the country, the girls are looking for certain things in the school environment to help them attend when they're on their periods. And I think products is one thing that's called out. Accessible, safe, private wash facilities is another critical feature. But third is also a supportive psychosocial environment from teachers and from fellow students. And we know that that's important as well. We also see in India that there's there's an opportunity through integration with other programs on health and nutrition to really advance action on menstrual health and hygiene. We have a very strong nutrition program that's looking at combating anemia, because India is a country which has very high rates of anemia in adolescents. And we have some adolescent health programs, both in school and out of school. I also do want to, I think, call out one thing is that while we've seen a lot of progress, we're also seeing that there is this is kind of a skewed investments on products and ensuring that disposable sanitary pads are available in schools, and that is often taken to be the key, the golden key to addressing menstrual health and hygiene. And I think that as advocates, and what this report can really do is to call for a more comprehensive approach towards addressing menstrual health and hygiene for adolescents, call for greater evidence that is required to make those connections with school attendance and school performance, and then later what those outcomes may be. I also want to point, like a last point is, while the school environment is key to intervene and provide menstrual health education, we do know that there are girls in India and in other countries who are not in school or who may have dropped out, especially we've seen this with the COVID pandemic. So we need to look and have a little bit of flexibility and approach with menstrual health and hygiene education. How do we address those who are not in schools, and also look at alternative formal and informal school systems that girls are engaging with, and where we need to reach them with menstrual health education and comprehensive programming. So with this, I'll end, Diana. Thank you.
Thank you so much, Arundhati. I think so many points that you said are critical. And one that came to mind, I love how you're looking in India, integrating the menstrual health education into other programs, and then really remembering that we have to do formal and informal education. But the thought came to me when you said, oftentimes we get a myopic view on the products, which is important, but there's so much more. And so I thought, this webinar is about menstrual health education, and that includes not only the girls, but the stakeholders as well, right? Those making decisions of power, to help them see this is a holistic problem. So thank you so much. So Jennifer, we know you've been involved a lot in policies and things. What responsibilities from your work do you feel the national, local governments have towards improving menstrual health? And also in your work, have you found the government receptive or resistant? If you could answer that, thanks.
Thanks, Diana. And I actually love what you just said a moment ago about the responsibility around education, not just being sort of our own educational landscape, but educating those who are in positions of influence and power to understand the holistic aspect of menstruation vis-a-vis all of the policy making that they do. So in the US, I think folks are probably familiar with the basics here. We got here, we got to the party a little bit late, and issues around access, particularly in schools and in other government agencies, particularly those where people themselves lack agency, where people are detained or incarcerated, and other emergency services are where the focus has been. Lawmakers in the United States have actually been rather receptive to these arguments. It's a newer policy agenda. I would say that in 2015, 2016 is when it began to take root here, in a very public way. And in that time, there have been multiple advances across the country in our nation that is very polarized by partisan politics. There's been an ability to sort of, create bridges around menstruation, and as many Republican-led states as Democratic-led states have seen progress. I think one of the things that is challenging about this work on the policy level here is that just the very nature of the structure of U.S. government makes it such that there are multiple levers for change, which is a good thing, but it's a challenging thing too, because oftentimes the same fights have to be had state by state because of the independent jurisdictions. There are limits to what the federal government can do. So while it seems that if Congress or the President of the United States could do something, like a full sweeping, stroke of the pen, people here look to Scotland a lot. They can make national law. Why can't we? It just doesn't work that way, is sort of the most simple answer. And there are limits to what the federal government can influence. And a lot of this work, as was referenced by everybody on this call thus far, has to be done at the local level with and by and for local stakeholders. One thing I want to say, though, that I think is shifting the landscape here, whereas I mentioned this is an agenda that really took root in 2015 into 2016. I think the pandemic changed the state of play here a lot in terms of how people in the US would define or acknowledge everything from economic crises to health crises to gender crises to racial crises. And so we're doing a lot of, I think, regrouping and re-envisioning and reimagining this agenda. Not to say that it wasn't sort of a fully intersectional approach from the start. It's a small movement here and I think a very progressive perspective. But I think the pandemic itself and the shifting of our politics in recent years have really brought new crises to the fore and are the impetus for all of us, including in the menstrual space, to take a fresh look at the kinds of policies and kinds of solutions that seemed appropriate or seemed most sweeping or achievable, even 5 or 6 years ago, to say that they can absolutely either be improved upon or reconsidered given what is happening in our lives and what is happening in our politics. Happy to give some examples on that, but I realize I've gone on kind of long, so we can save that for Q&A.
Wow, thank you, Jennifer, so much. I really like how you said, how can we look at this with a fresh view, a fresh look? And also what I think was powerful from your comments is really you can't underestimate the power of your local leaders and getting out in your communities and doing things that we need to focus at the local level and then coming at it with a fresh lens. Thank you so much. Bridget, as you are working in with local leaders, what do you feel the role civil society and NGOs play in addressing the challenges related to menstrual health?
Thank you so much. So the role of CSOs and NGOs in my lens, I'll divide it into 4. So the first one is awareness creation and service provision. Awareness creation in such a way that they highlight the harmful practices in the community. They highlight the inequality in product and education in terms of menstrual health. They also highlight the infrastructure gaps in the community, and it also gives information to the community on what the government has to offer and also the policies that the government have put in place. So, and then the second thing I see is the accountability actors. They participate in the budget making process, and then they also now act as watchdogs to make sure that funds allocated for WASH or menstrual health is actually used the way the government had intended. The third aspect is they act as research partners. That's why we are actually all here. So NGOs actually go to the grassroots, try to get information on what is actually happening. So in return, the government has the baseline data on what is there, and then they're able to recommend what we can do so that we can ensure that there's menstrual equity in our communities. And then what I can say also is they act as implementing partners towards the policies that the government has put in place. For example, now in Kenya, we have a policy and the government has outlined what needs to be done. So although it's not well implemented by the government, there's no proper budget allocation for it. NGOs now come in place, fundraise, look for technical people and try to complement government rules and actually make sure that these policies are working. So that brings me to another agenda where they help drive policies in different countries. We've seen it in Kenya. All CSOs and NGOs joined arms and let the government know that without us addressing menstrual health equity, we cannot achieve gender equity in our country. So I think in Kenya, it's just a perfect example of what NGOs and CSOs can actually do to make sure that menstrual health is an agenda in government. So thank you so much.
Thank you, Bridget. I agree. I think the NGOs, they come in and complement government and hold them accountable. I think that's so true. And then they can get that data that is needed to show the evidence to the government of why they need to do this. So thank you so much for, I really like the word that you use, that they're the watchdogs. That's great. So Florence, we want to turn to you as our youth activist. And what do you see on the ground or the barriers for young people in Uganda for them to be able to achieve adequate menstrual health?
Thank you very much, Diana. In Uganda, there are three major barriers. Yeah, I've been on ground for so many times working with girls and different people in spaces of menstruation, and I've realized that there is three. And I've realized that there is only three major barriers. That is like poverty. People, whenever I go in the village to interact with girls, most of them say they have limited access to clean and effective absorbents. In this, there is clean sanitary pads. This is brought about by poverty, whereby right now an household income in Uganda is less than $3.50. That means a household, even that household, even if it is having only one girl, it means it has to spend that less than $3.50 on all basic needs at home, at the same time providing even that means that money is very little to provide a pad for a girl in the house. Just imagine, it is the net income of all household in Uganda. Just imagine a girl in a village like my village, Kasanda, where I interact with a lot of girls. That means these girls, if in family there is not enough money to purchase a sanitary pad for a girl in the house, this means a girl will resort to other means of accessing a pad. In this, they go for like exchanging sex in return for pads, hence which comes with its own consequences. For example, the increasing teenage pregnancy, and that makes a cyclic poverty within our areas of Uganda, even Uganda at large. Cyclic poverty moves in like it is like a period cyclic poverty. It comes to generation, you get. Then there is another thing, like if they don't have access to pad, they also resort to other means of getting pad. Like we use, even me, I'm a victim of using these sanitary hard towels. You use that towel, then you, like, it is hectic, by the way. It is very hectic. You remove when it's very like itching, sometimes it causes burn. This makes it difficult for us girls, more especially in rural areas. Like to go to school, you feel you're not yourself because of that hard towel in you. Then it ends up causing us to do with unhealthy menstruation. Then secondly, there is an issue of climate change. Right now in Uganda, giving an example of my village where I come from, right now, everything we are experiencing droughts. This means we have to move long distances, like you move to get water. Just imagine when you're in your periods, you have to bathe, you have to go to school. These are the things, like little girls there, when I discuss with them, what they really tell me. You have to move long distances, the long distance to go and fetch water. Then sometimes they be left, you get, after not even being left at, only you reach at school late, you don't feel confident, sometimes you're not clean enough. I think that's also a major cause to unhealthy menstruation in Uganda, more especially in rural areas of Uganda. Then another thing is stigma encircling menstruation in Uganda. We have a lot of substantial embarrassment and teasing in schools, because boys in schools, they don't really understand what menstruation is. They don't really know what menstruation, how to they don't understand. So if they see a girl receiving a menstruation in class, that is it. It's when teasing starts. They laugh, they do what, like, these girls lose confidence to go back to school tomorrow because they will say, after all, these people have been laughing at me. Yeah, thank you, Diana. That's what I have.
Thank you so much, Florence. We really appreciate that you said the barriers were poverty, climate change, and stigma. And I think that we could say that's consistent. I know from our work, we see that in most of the countries that we work in. So thank you so much for bringing that up. For our next round of questions, we want to focus on the lessons learned from each of our panelists' advocacy work and how can we apply that in our different contexts. So Arundhati, I'll come back to you. What lessons from India in terms of menstrual health education can be transferred to other stakeholders in their contexts?
Thanks, Diana. It was great to hear everyone speak. So highlighting some key lessons from India. One is globally, we're paying more attention to the issues of bodily autonomy and choice as being critical. And I think one thing that the government of India has done, and this is advocacy work by the Menstrual Health Alliance India, is that we have now, we help support revised standards for disposable sanitary pads and had a very important component of, or an added criteria of compostability, because this has environmental implications and waste management implications. And we also now have standards for reusable or washable cloth pads and pleated underwear. And we think that this is really critical to push the advocacy agenda for informed product choice and ensuring that girls and women and others who menstruate have access to a basket of choice. The second is looking at menstrual waste, and we are one of the few countries where we don't have a policy, but we have a guidance document with some early initial thinking on this. And we're still trying to figure out how we can have a more concerted policy document on waste, but at least we have a guidance document. Third is, and this goes back to a point that I think Florence, Bridget, and Jennifer all raised, which is we need to educate stakeholders. And what we've done here is we have been educating government, but we also tend to look at government as one body, and they're not. India is a federal structure, so we have a national government, but we also have the subnational government, the ones who are really making the operational guidelines for translating policy and allocating those budgets. So we work with educating them on the need for a comprehensive programming and on important concepts such as choice and waste management. The civil society organizations that our collective reaches out to very actively, to some extent donors, but I think that we're scratching the surface to the usual traditional donors and we have to go more. And we do work with the private sector, but that's been limited. And I think it's a big call that we begin to look at the private sector and really think about how to engage them, and also look at private sector as a fairly large body. So how do we break it down and understand them? Just a couple of things I want to identify, and this goes back to some points, which is we require comprehensive programming, but also multi-year investments. And one thing that we've been able to do in India, which has both pros and cons, and I'm aware of this, is link with a high-level political commitment of the government. So the government of India often launches what we call missions related to health, water sanitation, hygiene, education, nutrition, and other development sector initiatives. And we've seen that when menstrual health and hygiene are made a part of that high-level political commitment for a mission, it gets attention, investment, and action support for that mission cycle, which is typically about 5 years. And that's critical. And we think that this has enabled greater action on menstrual health and hygiene over the past 10 or 11 years. However, this does have, I think, certain very significant backlashes as well, and happy to discuss that on chat. The last thing I want to leave the audience with, which ties back to this report, is there's a lot of great, simple innovations, interventions that are happening in India, various levels, as in many countries. And I think what we really need to do is how do we systematically and regularly collate these interventions and enable wider sharing and dissemination. Because one trap that I think we're falling into is we're reinventing the wheel a lot. And I think it's important to figure out these avenues. And in India, the Alliance is trying to figure out how to be a more effective platform for doing this. And the last point related to this is we also see the menstrual health and hygiene space education and beyond evolving as well, especially, how do we look at menstrual health aspects and components? And again, here, I think that we need to see collectively how we can build our understanding of it and ensure wider understanding of this evolving space and the areas that have received less attention, less investment, and to address that. And this, of course, includes stuff related to education, adolescence, but also beyond, taking us into the realms of adults who menstruate, the issues of perimenopausal and menopausal people, as well as issues related to disability, humanitarian context, and other issues that I think that we're beginning to grapple with globally. So thank you, Diana. Back to you.
Oh, Arundhati, I feel like, oh, you just gave us so many good nuggets that we could take. Just a couple that really resonated with the work that I do is being able to offer choice for bodily autonomy and self-care, and ensuring that the choice of the products in the basket are safe, and really, really making sure we have standards that hold the products to be safe for the women and people who menstruate. Also, I really liked what you said about menstrual waste. I do think this is an issue that has gone really below the radar, that we need to raise the awareness. And I love that there's a guidance policy for that. I think with the climate change and things that we're seeing, we really need to be aware of the waste management of soiled menstrual products. And also, I really liked what you said about engaging the private sector. I think it's time, and I know in our advocacy work, it's our job to find and make that bridge for the private sector to understand why they need to get involved. And so I think you've given a lot of good information there. Thank you so much, Arundhati. Jennifer, over to you. Are there lessons from the United States in terms of legislative action that can be transferred to other countries from your work that you've seen?
It's so interesting because what I've been thinking about, especially as I was just listening to Arundhati right now, is how much of what she was saying can be translated over here to the United States. And two things actually in particular stand out. When you both started to use the language of choice and bodily autonomy, I sort of felt myself sit up a little straighter, although they translate a little differently here in the US right now because of our Supreme Court and the debate we're having about abortion rights here in America right now, which have regressed dramatically since the court ruled this past summer. And I think about quite often, as I mentioned before, sort of what it means to link this entire discussion. The menstruation advocacy agenda in the United States has been successful, as I mentioned, if not, it's not at the same pace perhaps as where we are in other parts of the globe, but it's had quick traction. And I wonder how much quicker the traction might be if we start to open up the conversation. I do feel like it gets somewhat limited to very specific circumstances and a very sort of truncated dialogue about menstrual access. So as I heard those words, bodily autonomy and choice, that made me start thinking productively about what it would look like to broaden the conversation here. And like I said, it includes menstrual products and how we manage menstruation, but it also includes just overall education around menstruation. And one quick anecdote I will give that sort of links the two. Back about a year ago, when a law in Texas went into effect, even before the Supreme Court ruled this past summer, overturning the landmark case of Roe versus Wade in the United States, it led a very regressive abortion restriction stand in one state, in the state of Texas, for almost a year before that happened. And at the time that happened, the governor of the state of Texas did a press conference the day the law went into effect, and he stood on the steps of the state house and he said about what would amounted to a 6-week ban on abortion in that state, that people didn't need to worry because 6 weeks was still plenty of time to get an abortion. And it betrayed a horrible ignorance about menstruation writ large, that he thought that a 6-week ban on abortion was equal to 6 weeks to obtain an abortion, and anyone who knows anything about menstruation and how weeks of pregnancy are counted would know that the time most people realize that they're pregnant, they are about 4 weeks pregnant. So under a state with a 6-week ban, they have 2 weeks to get an abortion, not 6 weeks. And that to me was sort of underscoring the importance of our menstrual advocacy and why we need to teach lawmakers just the very basics about menstruation. But anyway, I digress. I think that the other thing that you said, Arundhati, that I think is a lesson that you're all experiencing in India that I think about a lot here in the United States too, is what it means to broaden the discussion beyond sort of certain ages and stages and interests in ensuring menstrual access. There's been a lot of focus on access in schools for very important reason, but also here in the US, we've seen an uptick in legislation and policy attention paid to issues of maternal health. The United States has dire rates of maternal health, especially for Black women in the United States. Discussions about women in the workforce, as we've seen the brunt of the pandemic hit mothers particularly hard. And of course, the attention to perimenopause and menopause and that entire stage of life, which for many people is as long as the years, you know, as we all hope, of menstruating, and the lack of education and resources is dire for many women. And so I think that all of that, what it looks like to make a more holistic agenda, I would say that here in the US, I wouldn't, we're not even close to mission accomplished, but I'd say we've succeeded sort of in passing the first threshold where there's media attention and public discourse at a rate that is far more productive than it had been, you know, 6 years, 8 years, 10 years prior. And our next hurdle is to ensure a more holistic, more inclusive, and more meaningful policy agenda than the ones, you know, than the particular bills and laws where we've seen the traction already. So again, I'll wrap it up there, but glad to answer questions if anything I said was evasive or vague.
Thank you. I feel like we could each just go on and on, but really quickly, one of the things I really liked what you said is we have to broaden the discussion. And I feel like looking at the US and other places, sometimes that entry point is talking about products, which is absolutely a need. But now that we've got our foot in the door, we have to pull back and help everyone see that it's the whole life course, right? The whole cycle of those who have periods from before their first one to their last one. And what does that entail? Education, wash facilities. And so I think we can leverage that. Like you said, it's a hurdle, but we can do it. We can definitely have those conversations and do educating to our leaders. Bridget, what lessons from Kenya in terms of the role civil society and NGOs play are there that can be transferred to other countries?
Thank you, Diana. I think one thing that as Kenyans we appreciate is that we've moved to a level whereby NGOs and CSOs are seen as watchdogs. And now NGOs and CSOs and government, we see each other as partners. So this makes it easy for NGOs and CSOs to work and also for government to implement their projects. And as a result, what is now happening in Kenya that could also happen in other countries is that CSOs and NGOs are now working closely with government to complement government efforts in achieving menstrual equity. So then what is happening? We are not duplicating government roles and government is not duplicating what we are doing. So in short, we are actually doing a lot with the limited resources that each team has. And then a situation also that is happening is that we are now going for joint funding in terms of implementing menstrual programs according to our policy, as well as, you know, also going for joint funding for research. And then again, now CSOs and NGOs are now performing monitoring and evaluation roles on behalf of government, because we know government cannot do everything and there are so many issues to sort. So the CSOs and NGOs are now coming in to tell government, like, this is where we were, this is where we are, where we need to go, and what needs to be done for these shifts to happen. So it makes it so easy for government to draft policies or improve policies and even put standards in place that can enable the the issue on menstrual equity to be reached quickly. Then another aspect that we see is that now CSOs and NGOs are now instrumental in the innovation sector, especially in menstrual health products. So now government is not now putting its energy on trying to figure out how they can manufacture products and all that. So for them, they've just put the policy in place and created an enabling environment for NGOs and CSOs to be innovative in terms of the products, in terms of how to disseminate the curriculum on menstrual health. So government is able to use its limited resources, focusing on other issues, while now NGOs and CSOs are taking up the space. And I can give you a practical example is right now in Kenya, there's now a lot of funding coming in for CSOs and NGOs that promotes innovation in terms of waste disposal, in terms of products, in terms of education. And this could only be achieved because now governments and CSOs are seeing each other as partners. So what I'm seeing for us in the next 5 years is that the gap on product access is going to reduce in a big way, because with so many products in place, for example, we anticipate that the prices will go down. There's also the encouragement of production of biodegradable and reusable menstrual products. That is what we do here in Days for Girls. So we are also seeing a situation whereby issues on climate change are being incorporated into this sector, as we all know that disposable menstrual products contribute a lot in terms of pollution. So like I said, in general, something that should be implemented globally is NGOs and CSOs should work closely with government and see each other as partners for this for menstrual equity to see the light of day. Thank you, Diane.
Thank you, Bridget. I really like how you said we have to move from being watchdogs to partners with government. Fantastic. I'm aware that we only have 4 more minutes left, so I want to pack in as much as we can. So Florence, very quickly, could you share with us an intervention that young people could do to help ensure menstrual health is being addressed in their communities?
Thank you very much, Diana. One of the things I would like young people to do, like to address the issue of menstrual health in Uganda, is that we have a lot of activists, these menstrual health activists on different platforms, that Twitter, on Facebook, but those people keep on retweeting, doing what and what, posting, but they don't really come to ground to see what is taking place, to know what is happening really. And even the organization do not know what is really taking place, and are the ones that engage in decision making, in policies, what and what, but they don't really understand what is going on the ground. So I think like most activists in spaces of menstrual health should come on the ground and understand what is really taking place, and so that they can implement properly what is feasible, not just retweeting what they don't really know about. I don't know the science behind people retweeting about menstruation, yet they are not coming on the ground to tell the people who are concerned about issues of menstruation. Another thing is like organizations should also at least come up with government, and they go in the community, not even teaching, but sensitizing the community about what menstruation is. Because the major thing here, like communities, more especially in rural areas of Uganda, they don't really understand menstruation, what menstruation is. There is a lot of social taboos attached to it. So I think government should come out, not thinking, but I urge the government and organizations to come and sensitize the mothers, more especially mothers, the students, the boys in school who engage with girls, I think it can work better. Thank you very much, Diana.
No, thank you, Florence. I really liked what you said, that we have to not just say words. I think that goes across the board. We need to have action, and then really getting to know what is happening on the ground. It's often very different than what we may think as we're working in different areas. So in our last few minutes, I want to come back to Noor for her to share quickly some transferable learnings from the study that we can use in advocating for menstrual education. Noor?
Thank you, Diana, and thank you all so much for your impactful and inspiring insights. As we've heard from our panelists today, with varied governance, funding structures, legal systems, and sociocultural understandings, it is impossible to define a single model for success, and every intervention has its shortcomings. But all of us have talked about some factors that do lead to more supportive environments. So I'd just like to cover a few of those. The first is centralized governance and a unified approach for countrywide coordination, resource distribution among local divisions, and accountability mechanisms. The second is sustained funding and devoted budgets from a range of public and private sources. The third is public, private, and NGO partnerships that fill the gaps when governments cannot and do not reach all sectors. The fourth is behavior change, which cannot occur without comprehensive education, training, and psychosocial support. So as we heard from our accomplished and diverse expert panelists today, progress will only be achieved when we all work together, when we have multi-party support and we have professionals across all sectors and all genders learning from each other to promote menstrual health. And I'd just like to point out, as Arundhati said earlier, when we are not reinventing the wheel, when we are really truly learning from each other and working together. Thank you.
Thank you so much, Noor. And I know I just will take 2 minutes to wrap us up and share some exciting things. But one, I just have to thank our esteemed panelists. Thank you so much, Arundhati, Jennifer, Bridget, and Florence, for your insights and sharing ways that we could learn from the work that's happening in your countries. And also a huge thank you to Noor and Sarah and their team at New Perimeter and DLA Piper for the outstanding research they did to provide us this excellent study. I think it is something it's looked at holistically, each of these 12 countries. It's pulled it together in a way that's very digestible. I think I mentioned earlier, there's 753 citations. It will be, I think, one of the main tools in my advocacy kit going forward, and I hope it will be for all stakeholders. As I shared at the beginning, we talked about that the International Day of the Girl theme recognizes that women and girls are playing pivotal roles to help shape a more equal future. And part of that is having accurate information about menstrual health. Today, we've heard how governments are getting involved and CSOs and NGOs to help make it a more equal future. We're excited to share that in the coming days, hopefully within the next day or two, we will share the recording of this webinar, as well as a link to the study that you can just digest and look at and see how you can use it in your advocacy work. And then also in about a month, Noor is putting together a high-level review, just a high-level like executive summary, summarizing the transferable lessons to use in our advocacy work. So please be watching for that to come. We hope the information from this webinar will help you in your advocacy efforts as we continue to work and advance menstrual health in our communities. Thank you so much, everyone, for attending, and especially to those who participated in our webinar today. We hope everyone has a great day, and please watch for the materials coming